Okay, so welcome to the 12th Journal Club meeting. So if you want to get your points, you can scan the QR code. The word for today is platinum.
Sorry, just getting it right now.
Did you get it?
Yep, I just submitted it.
Okay, sounds good. Okay, so basically the purpose of Journal Club is to introduce you to published literature, give you some exposure in a low stress environment on basically like how to read a research paper, practice your presentation skills, and then expose you to different areas of academia. So basically, the expectations are you've read the article before, try to bring up your own ideas, question the methodologies that they use, discuss the applications, just practice reading the literature and then identifying common structures and then, taking notes and annotating if needed. My papers always look like I covered them in highlighter and writing, so, okay. So the paper we're going to be discussing today is Mirv treatment in FR-alpha-positive platinum-resistant ovarian cancer. So basically the background. So epithelial ovarian cancer is the deadliest form of gynecological malignant cancer. There's over 300,000 new cases every year and over 200,000 deaths worldwide. The 5-year relative survival is approximately 50%. So like seen mostly, usually the tumors are very responsive to initial treatment with that platinum treatment. But then typically they relapse and become resistant to the platinum-based regimens. So currently there aren't very many regimens for platinum-resistant tumors that are effective. So basically what the authors of this are proposing, it's a third stage clinical trial, basically suggesting that Mirv, which is an antibody drug conjugate targeting folate receptor alpha, basically using that as a target for targeting those cancer cells, which the FR-alpha is overexpressed in the ovarian carcinomas and underexpressed in the normal tissue. And then the previous stage trials of Mirv had shown positive results. So basically, the purpose of this, they wanted to see and assess the efficacy and safety of this treatment in targeting the platinum-resistant ovarian cancer. And they suggested that this treatment would be more effective than non-platinum chemotherapy, which they basically tested their results against. So to design this, they used a randomized controlled trial with over 400 patients. They did use an open label design, which eliminates it being double blind because the unique dosage and examination schedule for each of the different types of treatment. So they had a 1-to-1 ratio between the Mirv group and the chemotherapy groups, and then they had the 3 different types of chemotherapy, not equal distribution between those groups, more based on patient-specific needs. Like I said, there was no random assignment to the chemo-specific groups. And then basically participants must have the confirmed diagnosis of the platinum-resistant and then the high-grade cirrhosis ovarian cancer, and they must have had previously received 1 to 3 previous lines of the systemic anti-cancer therapy. So they did have quite an extensive criteria to be a part of the clinical trial. Okay, so basically for the results, addressing the efficacy. So what we can see here is the progression-free survival. So how long did they basically live for with seeing 0 growth in the tumor, and then the overall survival is seen here. So all results were investigator assessed. So the progression-free survival was significantly longer along the Mirv group compared to the chemotherapy group, as you can see here. almost 2 months longer. Additionally, they had a significant higher percentage of just the objective response in the MIRV group than in the chemotherapy group. And that was with both the complete and partial response. There were, I think, 15 patients in the MIRV group that had a complete response, while 0 had a complete response within the chemotherapy group. And then for the median survival, or the overall survival, as we can see here, the MIRV group had a significantly longer time than the chemotherapy group by almost 4 months. Okay, for the safety, so there were adverse events seen in both groups. The most common adverse events in the MIRV group mostly had to do with vision and issues with ocular damage. So most of it had to do blurred vision, the keratopathy, and then abdominal pain and some fatigue. To try and balance this, they did have patients using multiple day eye drops to like try to combat the ocular damage. And then they found when they did cease treatment, there was no permanent ocular damage. For the chemotherapy group, the most significant abnormal events were anemia, nausea, neutropenia, and fatigue. There were patients in both groups that did cease treatment because of these adverse events. So basically, what they found was the results of this trial supported the 2 previous trials, Forward 1 being another stage 3 trial. This trial, known as the MIRASOL trial, showed significant benefit of the MIRV with respect to the progression-free survival as compared to the chemotherapy. Additionally, there was no new safety signals that were observed. Basically, the safety signals stayed as the same. They already knew that it targeted ocular. They knew some low-grade gastrointestinal and some neurosensory issues. Okay. So for limitations, the eligibility criteria was very exclusive, which could affect its generalization to the trial population, with the restricted enrollment and the exclusion of patients with the primary refractory disease. Additionally, if you look at the of the participants, they generally lacked racial and ethnic diversity, despite being a global study. Additionally, it was investigator assessed results, so not necessarily independently assessed or reinforced. Another issue was that they lacked randomization of assignment to chemotherapy groups. So basically, like, there's a little less controlled with that. It could have been a little bit biased there. Additionally, they didn't assess the difference between the efficacy and safety between the different chemotherapy options, seeing if one was significantly better than the rest that may have skewed the results of the others. Did you see any other limitations in the study?
From what I was reading, I guess that seems pretty full, but I just found it interesting how many adverse side effects there were in the trial compared to chemotherapy, and it seemed like even worse than side effects of chemotherapy. So I thought that was interesting.
Yeah, I mean, especially with like, you would think with it targeting that specific receptor, it'd be a little bit more like specific to which tissues it targeted. So it might be interesting. That could be a future study on why it targeted those like the ocular.
Yeah.
Okay. And then what would you consider like some of the strengths of this study?
I mean, the obvious one, it increased life expectancy, but like just looking at the side effects, it's like at what cost, especially because
Yeah.
40% had blurred vision. Do you know if that blurred vision was like severe, or was it just like occasionally blurred vision occurred, or was it like a constant thing for them?
I think from what I read, it was constant in some. There was some patients that like the blurred vision was enough for them to withdraw from the study, and others that like it like wasn't severe enough. I don't know, like it did not talk, I don't think it talked about specifics of like how often the blurred vision occurred, but yeah.
Yeah. I guess those are right now some of my thoughts on that, but
Mhm.
I guess I just wondered, um, just because like yes, there are 4 extra months, which I think overall that was like the medium um difference in the matter of months, right,
Mhm.
between chemotherapy versus this therapy.
Mhm.
Um, but it's just interesting like why it affects like ocular, like why it affects the eyes so much, I guess.
Yeah. I mean, and like even before like going into this specific trial, like they knew that was part of the like safety issues. So like as part
Mm.
of this, they did like assign those patients like to get eye drops, and like they still experience that blurred vision and some discomfort with that. So, okay. So future studies, basically, they could assess the efficacy and safety of combination treatments against the singular treatments of MIRV or chemotherapy. I know a lot of times, a lot of studies now are trying to see like combination drugs, see what works together. So I mean that would have to like once the MIRV gets approved and like go back to like stage 1 trials of like do these combinations work together. Another idea is assessing the efficacy and safety against more treatment options besides just chemotherapy, like if there's any other platinum, non-platinum treatment options. Additionally, they could retest the hypothesis with a more diverse study group or different participant requirements, maybe make it a larger group of those with the platinum resistant and try to include more than the strict exclusion. Did you have any other ideas of what, like, besides what we just talked about, but yeah.
Not really. Again, I think you covered it pretty well in
Mhm.
terms of cancer. I know like there's immunotherapy, which is definitely now very prevalent, I guess,
Mhm.
or maybe it's researched more often, so that can be maybe more cancer related therapy compared to like MIRV and chemotherapy, and
Mhm.
maybe how it affects that specific type of like cancer. Like, yeah, that's all I have right now.
Yep. Okay. Yep. And then do you have any questions or further thoughts?
Not really. I think
Okay.
you covered everything pretty well.
Okay, sounds good. I'm gonna stop the recording somehow.